Hi, I'm Dr. Moffic, Stephen Moffic. I'm on the editorial board of Psychiatric Times for quite a while, and you may recognize me for over the last, I don't know, 5, 6 years. I've done a weekdays column on psychiatric issues in society, and then a weekly video on society and psychiatry. And I'm 80 years old. One of the things this year, besides being involved with, I don't know, 7 presentations, is I got 2 awards, to my surprise. One of them is called the Oskar Pfister Award, which is an award for contributions to psychiatry, religion, and spirituality. Most people don't know who Oskar Pfister was. He was a minister who actually worked and studied with Freud, challenged Freud, and Association of Clergy and the APA put together an award back mid-1980s or early 1980s. One of the first awardees was Viktor Frankl, the author of Man's Search for Meaning fame. Oliver Sacks, the neurologist, was awarded, and Robert J. Lifton, the psychiatrist, among others. So I don't, this is pretty intimidating territory. So my talk basically, my lecture that I had to give was basically on the 4, really 5 books on religion and psychiatry that I led editing: Islamophobia, antisemitism, Christianity, the Eastern traditions, and spirituality, and the second edition of Islamophobia, which has some controversy with it. So that's that award. The other award is Senior Psychiatrist Berson Award, put together by a psychiatrist named Dr. Berson. I didn't know him. It's been around now for about a dozen years and has to do with continuing to make contributions as you age. And that's why I said I was 80, because I definitely fit into the group age-wise. Otherwise, lots of psychiatrists could be given this award for their continuing contributions. It's a really complex question, the role of social psychiatry and what it should be. We've had this biopsychosocial model for 50 years. Dr. Engel established it in medicine, and it got applied to psychiatry. But it's never been a prominent part of the model, partly because I think it doesn't pay. You get paid for doing psychopharmacology, the bio, important. You get paid for doing psychotherapy, which is the psycho part, but you don't for social stuff. I mean, I guess you could consider group therapy, family therapy, social-oriented therapy, but the central thing is everything's social. Our relationship with a patient is the essence of social relations in the world, and how that goes determines whether you have compliance and so forth. So the social is right there all the time, and to neglect it is problematic. Not only to say that the social has to do with how society views and funds psychiatry, so it's so essential. But I'll also add on, this meeting, I think, complicated this whole model, because to me, this meeting is like a Rubik's cube of psychiatry. It's a challenge to put together all the components. And 3 other components I would mention is the technology, the ecology, and the moral. There's a bunch of sessions on moral injuries, which are affecting psychiatrists and physicians, because there's a lot of compromise that we have to deal with in what we do every day. So how to put together all these and probably other components of psychiatry is really difficult, but it all goes down, I think, to the basic human issues. How do we relate to one another? When I mentioned the technology, techno, as part of the model now, I think besides social media, one of the big challenges is AI, of course. That's nothing innovative for me to be thinking about, except that I'm so technologically ignorant. But so I can't use AI like everybody else. But how much will AI help, and how much will AI hurt patient care, as well as the rest of society for that matter? So can it be used in a way to supplement what we know and do, and save us time? Time is a big issue. Or is it going to distract us in a way, or make us conform to certain ideas that are out there that might no longer be so relevant? And so I'm looking forward to how we address that. And connected to that, I think, is the moral injuries I mentioned before, which relates to burnout. And burnout is still an epidemic in psychiatry, but creeping up and associated to that is moral injuries. And how are we going to help psychiatrists get over moral injuries? That may be the biggest challenge of all, because it makes us feel bad about what we do when we have those and recognize that we have them. And there's no obvious treatment right now. It depends on the field adjusting to what's going on in the world. Now, one more challenging thing happened last night, which I think relates to moral injuries. There was a lecture scheduled in honor of Chester Pierce. It's a new award. And the psychiatrist who was to deliver it, Dr. Mansour Malik, he got the award, but the lecture was postponed because it was too controversial, especially in the title, adding genocide in the title. And I think we have to find ways to deal with these interfaith conflicts, not only in psychiatry, but in the world. And if anybody should be able to do that well as a field, it's psychiatry. So that's also an ultimate hope for myself. Psychiatry is such an important field because it deals with limitations on who we are as human beings. I think ultimately what we can do in patient care that's so important, besides trying to reduce symptoms, maybe even cure a patient or two, is it has to do with freedom of the mind. I think when we're successful in working with patients, it frees up their freedom of mind so that they can think more helpfully about what to do in their life and what their life is about. And we're living, not to bring in politics too much here, but we're living in a kind of repressive time now where freedom is being compromised, and maybe even a little bit within psychiatry itself. And so that to me is the ultimate contribution psychiatry can make to people in the world. It frees